Hi everybody, it's Adam, the geneticist from Verdure Healthcare, and welcome to my session on chromosome 10. So I hope you've enjoyed my last session on answering some of the questions in NIPT. So today we're going to continue our chromosome series. So today we will talk about chromosome 10. So as you can guess, chromosome 10 is the 10th largest chromosome in our human body out of the 23 pairs. So chromosome 10 actually takes up around 4% of our total genes. So more or less the same as chromosome 9 last time. They also took up about 4% of our total genes. And so just a quick reminder on the relationship between a chromosome and a gene. In fact, genes are within the chromosome. They are just like a pack of strings, all right? And there are only 4 genetic codes, which is G, C, A, and T. And all of these genetics traits that we all have different compared to each other comes from the differences between these codes. Okay, so chromosome 10 actually has around 133 million DNA pieces, and this is the map of it. So as you can see, there are different colors and they code the different regions. So all of these very small coding, you might not even be able to see them through the camera. So they are the location of specific genes. Okay, in fact, this is going to be a short session because there are 4 very common diseases that are associated with chromosome 10, include 10q26 deletion syndrome. So 10q26, that marks the region of chromosome 10, distal trisomy 10q, gyrate atrophy, and Refsum disease. All right, so let's have a bit of a review on the types of genetic diseases before we really get started. So single gene disorder, meaning to say that, okay, so within the 4 most common genetic codes, GCATs, so some of them might be replaced by another code that shouldn't be there. Some of them might be duplicated or even missing. However, on the chromosomal abnormality level, meaning to say that there is a large chunk of chromosome either being missing or has been duplicated wrongly. Okay, so the first disease we're going to talk about is the 10q26 deletion syndrome. All right, friends, by now if you have been watching my series, you should by now know what is deletion, meaning to say there's something missing. Okay, so 10q26 is a condition whereby a small piece of gene or DNA has been missing, and this is the 10q26, which is around this area in the so-called long arm of the chromosome. Okay, so this is the chromosome, this is the short arm, and this is the long arm. Okay, all right, so what's going to happen? So when a baby has these diseases, they're going to have a very special or distinctive facial features. They're going to have growth problems, most probably going to have some mild to severe intellectual disability. Well, one thing that is worth noting is that they're going to have genital abnormalities in male. Okay, in male. And sometimes they might have even skeletal or even heart defects. All right, so for guys with this particular deletion syndrome, when they have genital abnormalities, most likely they're going to have fertility problems as well. All right, so this is the normal chromosome 10, all right? As you can see, it might be twisted a little bit, that's fine. But if there are some parts missing down here, that's not okay. That will be the 10q26 deletion syndrome. Right, so just now, that disease was something being missing. But for the distal trisomy 10q, it is exactly the opposite. So distal trisomy 10q is a very rare chromosomal disorder. All right, so it is at a chromosomal level, not at the gene level. Just now it was at a single gene level, but now it is much bigger than that. Okay, whereby the long arm, okay, remember what's the long arm? The bigger part or the bottom part of the chromosome. Of chromosome 10, some parts of it actually got duplicated 3 times instead of 2 in the body. Okay? So these are some of the features. As you can see, the fingers got bent all the way back, which is very scary. The teeth is also quite distinctive. As you can see, the shape of the hand is curved, right, and the ear is also not so normal. And now, as you can see, this is chromosome 10. The normal one is here, but now, as you can see, there's parts being duplicated and longer than necessary. Okay, so this disorder is actually characterized by unusually slow growth. Okay, and that applies to before and even after birth. All right, so normally when, for example, if the baby is already in 6 weeks of gestation, they should measure, a total size, a certain size, but now they are less than that. So when they are born, they will have diminished muscle tone, okay? Meaning to say that they are not able to maintain in the position for too long, because as you can see, I'm standing here. Actually, some of the muscles are contracting in order to make me stand straight. All right. If you have weak muscle tones or diminished muscle tones, you will either be shaking or you are not able to stand at all. All right. Mild to severe intellectual disability. That's, I think, some of the most common features across all the genetic diseases. Also delay in the acquisition of skill, of course, because they have diminished muscle tones, and also especially when it requires the coordination of mental and muscular activities. Okay? Right, so sometimes they have very special malformation or distinctive features, such as the features of the head, the facial or craniofacial area, all right? Defects of the hand, as you can see in the picture, the feet, sometimes they have cardiac or heart problems, kidney problems, and even sometimes respiratory problems as well. It really depends on which part has been duplicated 3 times. All right. So as you can see, this is a very broad There is a very broad characteristic for the distal trisomy 10q. All right. So now, okay, here is the thing I need you to concentrate on. Do you think the parents themselves would have distal 10q and still, have babies? Chances are not really, okay? So where does this disease come from? What happens in between? So, okay, the trick is called balanced reciprocal translocation. Now, I know the name sounds scary. Let me explain what's going on here. So, as you can recall, each human has 23 chromosomes. But what happens? What do you think will happen, in other words, if, let's say, 2 chromosomes, the materials between 2 chromosomes has been swapped? All right. Do you think that there will be a problem with that particular person? Well, the answer is not necessarily they will. All right. Why? Because as long as you have 100% of the genetic material required, you are okay. But if, let's say, for example, if you have duplicated ones or deleted some bits, then you're not okay. So, distal trisomy 10q is a result from either the father or the mother having a balanced reciprocal translocation, whereby they themselves don't have extra or less chromosome materials, all right, but the locations are different. I'll explain in detail later on in a while, all right? Okay, moving on. All right, the third disease we're going to talk about is the gyrate atrophy. So as you might recall, the title of this particular session is Chromosome 10 and Total Blindness. And this is the disease that's going to cause total blindness, because when people have gyrate atrophy, they suffer from the shrinking or the atrophy of the choroid, or the thin coat of the eye. And as a result, the retinal phase has a progressive loss of vision. All right, and usually it will cause total blindness when the person reaches around 40 to 60 years old. All right, and this is due to the disease of an inborn error of metabolism. Okay. And the last disease I want to talk about is the Refsum disease. Now, I believe that many of you haven't heard of it before, but anyway, it is also a very rare disorder because of the lipid metabolism that has an error in it. Okay, so the symptoms might include, first of all, degenerative nerves, okay, or sometimes called the peripheral neuropathy. Okay, or failure of muscle coordination, also known as the ataxia, all right, and also a progressive vision. It is a progressive vision disorder, and sometimes it also has bone and skin changes as well. So the symptoms is also quite wide. So why? Okay, some of you have asked me, Adam, why, given that, okay, Child A has Refsum disease. Child B also has Refsum disease, but the symptoms tend to appear differently. It is because even within the same disease, there are different versions, all right? And I mean, even the same code has been missing or has been mutated, it can mutate differently, okay, from person to person. Okay, so this is the reason why, in terms of severity and in terms of the symptoms, they can sometimes be different. All right, so what are the treatments to these genetic diseases? Now, I would strongly advise prevention rather than cure. Why? Because, okay, let's talk about the mechanisms first. If there's a mutated gene and you want to cure that person from there is transplantation, also called the gene therapy, but now it is still a very unstable technology. Mutated protein, all right, you can do some protein replacement, such as if you inject hemophilia A, all right, into blood diseases, enzyme replacement therapy for lysosomal diseases. Yeah, they are available, but sometimes, like I said just now, different versions of the same disease would require a different medicine. So metabolic dysfunction, so just now there were at least 2 diseases related to metabolic errors, especially inborn metabolisms. You can actually use diet modification, lifestyle modifications, or sometimes you need pharmacological agents in order to control that. Okay? Or if it affects the entire organ, like the gyrate disease, the progressive loss of vision, you want to replace the eye, it is also okay to do organ transplantations, such as the transplantation of the retina or even transplantation of the eye. So this is done by surgical interventions. But of course, you need to have the reconciling organ and also the organ of your blood type in order to do so. All right, so the best solution right now, especially when you're preparing for pregnancy, is to get genetic counseling. Get yourself genetically tested so that you don't have to go through all these dramas. So at Verdure Healthcare, we have something called the Prepregnancy DNA screening, whereby, okay, why do we want to screen for such a thing? Okay, if you were to tell me, Adam, I don't have genetic diseases, me and my family look absolutely fine. All right, so maybe you want to have a look at this article over here from the University of Chicago, their School of Medicine, back in 2015, they have already mentioned that humans carry 1 to 2 lethal recessive mutations on average, study estimates. All right, and that includes you and me. So if humans carry on average 1 to 2 mutations, that, if inherited from both parents, can cause severe genetic disorder or death before reaching reproductive age, report scientists from the University of Chicago and Columbia University. So these two very well-known universities based in the US, they have held hands together and they've done this research that shocked the world. All right? So now this is international news, but what about Malaysia? Unfortunately, in our situation, we don't have any advantage. Okay, so some of you who are thinking, all right, that is in the US, so sometimes their research doesn't really apply to us. But unfortunately, the UN Specialist Center, okay, they have made this statement. Yearly, around 16,500 of Malaysia's 550,000 babies are afflicted with congenital abnormalities, and about 1/3 may succumb to these illnesses before their first birthday. All right, the fancy word here is succumb, which means die before they're reaching their first birthday, okay, because of whatever disease that they have. Now, friends, if you have learned fractions before during your middle school, you can actually tell that that is 1 in 33 babies in Malaysia being born with congenital, meaning something that you're born with, okay, abnormalities or genetic diseases. Friends, please tell me that is not scary. It is extremely scary. But the good news is you can prevent it. Because at Verdure Healthcare, our pre-pregnancy DNA screening program, we will have 2 reports. The first report will be to screen every piece of your chromosome. All right? From the first pair all the way down to the 23rd pair, we will screen them. Okay, so what are we looking for here? Deletion. All right, so most likely if you have a deleted piece of a chromosome, you would have known by now. But anyway, deletion meaning to say that there is a large chunk of chromosome missing. Duplication, which is exactly the opposite, whereby when this is the normal chromosome, this section over here, or any section in fact, is just an example, got duplicated and has been elongated. Okay, an inversion, meaning to say that, okay, a normal chromosome, there is nothing in addition or nothing has been deleted, but point A, point B just swapped around, okay? Substitution, okay, let me give you an example. If this is chromosome 4, this is chromosome 20, something from chromosome 4 actually went to chromosome 20, okay? Translocation, or also known as the balanced reciprocal translocation, means that, okay, for example, chromosome 4 and chromosome 20 again, so they have swapped around, okay? Something from chromosome 4 went to chromosome 20, and then something from chromosome 20 actually goes to chromosome 4. Now, for substitution and translocation and also inversion, you will be fine. Okay, so sometimes when in fact, recently we have received a lot of couples who has faced miscarriage. That is very unfortunate. Partly it is due to the COVID-19 pandemic causing the stresses, but there are also a large portion of them with such situations. All right. Fortunately, they haven't brought any other diseases like thalassemia, spinal muscular atrophy, gyrate disease. Lucky they don't carry any of them in their body. But still, when they have substitution or translocations, we will need to prepare them to do IVF, and even for IVF treatment, we need to add in embryo genetic selection, or also known as the PGS-PGD, which I'll explain to you later on. So the second part is the core, okay? So just now it is a chromosomal screening. Now we need to zoom in the chromosome, and we need to do a lot of work whereby we have the sample genes and we amplify them. And we need to extract the code that is showing in the genome. And this is a very complicated process. It takes the entire professional program to actually teach. Okay, so this is a result that it will generate. For example, this, I believe this is a wife's report. So she's carrying beta thalassemia, Smith-Lamley-Opis, and Wilson's disease. So as you can see, they have very complicated code changes. So let me share with you an extra piece of information. So nucleotide change, or also known as the amino acid change, sorry. So for example, this is the location of that particular gene, and supposedly it is going to be a C, okay, but it has changed to a T. And that is not okay, because this means beta thalassemia, all right? And for this one over here, let's take a look at this. This is also at chromosome 11. From C770C, it has changed to a T. That's not okay, because this is Smith-Lamley-Opis syndrome. And let's have a look at one more. Chromosome 13, C2755. Supposedly it has to be a C, but now it has changed to a G. And that is not okay, because this is Wilson's disease. So as you can see, this is a very, very small change, but it is enough to become a mutated gene. And fortunately, her husband wasn't carrying any of these diseases. So that's why even though the wife is carrying 3 diseases, worst come to worst, the baby will inherit all these diseases as a carrier, but they will be fine for the rest of their lives, okay? Right. So it is quite a complicated process. But anyhow, the result is that we need to do a risk assessment, okay? So that's why we need to draw out the pattern whereby if, let's say, okay, using that example just now, beta thalassemia, if the wife has beta thalassemia gene being carried in her body and her husband is also a carrier of beta thalassemia, there will be a 25% chance of the baby being afflicted with beta thalassemia. 50% chance that these 2 babies, they will walk away as a carrier, but they wouldn't be affected by the disease. And there is only a 25% chance that this baby can escape completely. Now friends, please tell me that 25% chance of the baby being unhealthy and there is no cure to it, okay, I don't think anybody is willing to take that risk. All right, so now, what do you need in order to become a genetic counselor? Who is qualified enough to actually speak to you about genetics, to analyze the report about genetics, and also to tailor-make a fertility solution for you? All right, so, okay, myself, I'm actually qualified as a surgical instructor because I've received a postgraduate certificate in surgery for the Royal College of Surgeons of England. Okay, but that is still not enough for me to talk to you about genetics because you need to be further qualified. So that's why there aren't many specialists that can speak to you about genetics. All right. In Malaysia, as far as I know, according to the partner lab that we work with, there are only 5 people, including myself, that are able to do genetics. 2 of them are in HKL. They are under the Department of Pediatrics. They won't accept anybody who is planning to get pregnant because they are already busy enough of taking care of the babies who are already being affected by genetic diseases. Okay, so in order to be further qualified, you have to get a qualification similar to this. Be certified as a geneticist first. Only then you can specialize in an area whereby if you want to sit inside the lab or if you want to come out and talk to people. So I decided I love talking to all of you. So that is why I've decided to become the genetic counselor, and I've received the certification from Harvard Medical School, especially in genetic testing and sequencing technologies. All right, and as you can recall just now, many of those sequencing technologies and genetic screening, they produce a lot of complicated data, and you need a further qualification such as this one over here that I've received from Johns Hopkins, whereby you will be taught about how to use a series of computer programs to sort out the data in order to make it into a useful report so that I can actually plan out the best solution, most cost-effective, and also to secure you a healthy baby. Alright, so some of you might have heard of commercial genetic tests. So for example, 23andMe, Circle DNA, if you have gone to YouTube, so most like chances are you will come across one of their advertisements. But these tests are for wellness, okay? So when you go to the website, click on Add to Cart, buy it, and they will send you the package. Open the package, follow the instructions, swap your saliva, put it back into the test tube, send it back to them, and you'll get your report. That is as simple as that. But the thing is, it cannot do any clinical decisions. What's the difference between clinical or not clinical? Well, clinical, the most obvious difference would be that clinical genetic tests should be followed by a medical solution. Okay, so for example, if touch wood, you and your husband or both of you are carrying certain type of genetic diseases, we need to send you to IVF. And within IVF, we need to do the embryo genetic selection, and we need to communicate with professionals from the multidisciplinary team. All right, so after you get yourself genetically tested, the second step would be to enhance the quality of your sperm and the eggs, because we really don't want there to be spontaneous mutations such as Down syndrome. Down syndrome is not inherited. It is caused by bad quality sperm or egg cells. Okay, just to put it in a more simpler term. Anyway, so in order to enhance the quality of your sperm and egg cells, we have some award-winning fertility herbal supplements designed for just that purpose. In fact, we have won the Reader's Choice Award 2021 that is awarded by Baby Talk and Mama Papa magazine. We are really proud of that, so thank you so much for your support. Our VHC formula, female 1 and female 2, they are specifically made to enhance the ovulation function and also to enhance the quality of the egg. And our VHC formula male is specifically made to enhance the sperm function, including the quantity and also the shape of the sperm, the swimming capability, and etc. Okay, and furthermore, even our after birth recovery package has also won the Mama Papa Reader's Choice Award. So this is the VHC formula confinement 1 and confinement 2. So you take them together. So after you've delivered your baby, you need to recover. Okay, so it is a whole package whereby we'll teach you some of the menus that should be prepared while you're recovering from that, and yeah, you will be better prepared also for the recovery and also for your next baby. And furthermore, we have won the Super Brand back in 2021. And yes, we've been here for 18 years already. And thank you so much for your support. And you know, Super Brand means a lot to us. It also gives you the confidence whereby we are in fact an honest merchant, an honest clinic. We will do our very best for you. Okay, so the third step is to actually go for the pregnancy. Either if you are fine, you don't have any mutations, you should go for natural pregnancy, or if you do carry the same diseases, then you should go for IVF. All right. So if you decide to go for natural pregnancy and you want a shortcut, okay, we have created one for you. The home artificial insemination, IUI, whereby all you need is just 3 simple steps. Track your menstrual cycle, confirm ovulation, do the insemination. That is as simple as it is. Okay, let me explain in a bit detail. So the first step is to grasp your menstrual cycle, and we have the chart over here so that you can record your basal body temperature. When you're ovulating, there will be a bump of temperature, okay, because of the surge of a hormone called the luteinizing hormone, or LH in short, and that is the hormone that is responsible for stimulating egg growth, hence the ovulation. All right, so if you can catch this window time over here in your next charting cycle, then you can use the ovulation prediction test kit called the LH ovulation test. We have imported this from England, by the way. So if it shows positive, then congratulations, you are ovulating. Then on the day, you can ask your partner to produce a sperm sample. You can use our artificial insemination toolkit. It is totally medical safe. It is silicone made. All you need to do is to assemble the hose with the syringe. You pick up the sperms and then you inject that directly into the uterus. Simple as that. Okay, 6 simple steps. But okay, so anyway, for this particular package, the home artificial insemination IUI, it is very suitable for male with low sperm count, poor sperm movements, or even abnormal shape. And for ladies, if you have high amounts of antibodies or suffering from recurrent genital infections or even pain during the intercourse, then this is a shortcut for you. Right, but if you are carrying same kinds of genetic mutations such as thalassemia, then you will need to go for IVF, all right? But you might have a question, why not we all just straight away go for IVF? 2 problems. As you can see, this is the embryo, but how thick is the needle? Of course, this is graphics, but the proportion or the ratio between the needle and the embryo is actually correct. So due to its nature, it will not increase the chances of success, but whereas in the exact opposite, it might even hurt the embryo. So that is why even if you want to go for IVF, we need you to enhance your sperm and the egg cells. That is exactly the reason. Okay, so this process is done after when the sperm and the eggs has been produced, fused together, put into the lab in the artificial womb for around 5 to 6 days, and before transplanting it back into the womb. Okay, so that is the process. So in this case, what is the problem? Okay, one problem is the, as I mentioned just now, is the success rate. Second is the money, because it can cost you quite a lot. If you can go to Google and search cost of PGS-PGD in Malaysia, okay, so by the way, PGD stands for pre-implantation genetic diagnosis, and PGS stands for pre-implantation genetic screening. Okay, and these 2 can be categorized under embryo genetic selection. So this can cost you around 35 to 50,000 on top of your regular IVF fees. Right, so at Verdure, you don't one-stop fertility solution center whereby we work with many partners such as BP Path Lab, Alpha Fertility Center, TMC, Sunway, Thompson, Sonovision, Gribbles, and even for genetics lab, we have 2 partners. One is genomics lab and one is DNA lab. So you remember this, please, guys. Your genes determine your baby's lifetime health. Genetic diseases cannot be cured completely because it is the gene, right? And so what we can do as parents-to-be is to prevent diseases from being passed on to our children. Okay, so if you're planning for a pregnancy, so please do give us a call. We would love to hear from you because our healthcare services executives will be able to help you out making an appointment. And if you want to know more about the pre-pregnancy DNA screening, please do give us a call. So this video will be uploaded to YouTube. Kindly share, like, and subscribe to our channel, and we would love to see you again next time. Thank you very much.